Drugs given directly into a vein are called intravenous or IV drugs. These drugs can be given in a variety of ways, either through a cannula via PICC or into an implanted port. Cannula. A cannula, a very fine, short plastic tube, may be inserted into your arm or hand for treatment. A new one is placed each time and removed before going home. Peripherally inserted central catheter, PICC. Alternatively, you may be referred for a PICC placement. This may be before treatment or later on. Your PICC can be placed at Mount Vernon Cancer Centre or at Lister Hospital, and it will be in a dedicated room that looks like this. A PICC is a thin polyurethane tube that is placed in a vein in your upper arm above your elbow. For comfort, consider wearing short-sleeved or sleeveless clothing on the day of placement. We start by using ultrasound to locate the best vein in your arm. Local anaesthetic is used to numb the skin before placing the PICC. We will also connect you to an ECG machine to ensure the tip of the PICC is in the right place. And occasionally, a chest X-ray may be needed to confirm its position. As we need to make sure everything is done to protect against infection, the procedure looks way more dramatic than it actually is. We have to dress up in gloves, gown, mask, and hat, and cover you with sterile drapes. We will explain the procedure in detail during your appointment, and you can find additional information on the Macmillan Cancer Support website. Implanted port. Alternatively, you may have been referred for an implanted port. It's a device placed under the skin, typically on the chest wall or upper arm. This procedure is performed in the X-ray department. If you're having a port placed at Mount Vernon Cancer Centre, you'll receive 2 appointments at the John Bush unit. The first one will be to discuss the procedure, gain consent, and have blood tests. The second one, usually a few days later, will be for the port placement. If you are having a port placed in the Lister Hospital in Stevenage, you will be given information on the process by the nursing staff in the Lister Macmillan Cancer Centre. Then, you'll receive an appointment from radiology for the port placement. You can find more information about implanted ports on the Macmillan website in the section on central lines.